Welcome back to the show. We're so glad to have you back. I'd like to introduce my new guest. I haven't been on my show since November 2018. So it's been a long time since I've had her on, and a lot of updated information that we're going to have. Her name is Shelley Poerio, and she is the president of Living Free and Fitness. Oh, that's a mouthful. So let's find out what that's really all about. Shelley, welcome to the show.
Thanks a lot, Tom.
I should say welcome back to the show.
Thank you. And I'm happy to be back. It's a great opportunity, and I love meeting with you and talking with you. It's Living Free Health, or Living Free Health and Fitness is the long name, but
Yep.
kind of sounds a little bit like a gym. We have a lot of fitness orientation and healthy nutrition as part of our addiction recovery focus. Our mission statement is treating addiction with whole health solutions,
Okay.
so it makes sense. But there was some confusion, and it's just like you said, it's a mouthful to say. So we shortened that to Living Free Health. So yeah.
Okay, how long have you been in Pahrump?
Well, I personally lived in Pahrump since October of 2017, and relocated the company here at that time.
Okay.
So yeah, it's a little over 3 years, and it's been great.
Well, who do you serve when you look at your clientele, and you've got to also talk about what do you do for those people that you serve? Sure.
So Living Free Health is a 501c3 nonprofit public charity. That's how it's designated with the IRS. And our focus is on treating people with addiction. And initially, I had founded the company with the idea of helping people sort of post-treatment. So how do you get them from the 3-month milestone to the 12-month milestone, where at 12 months clean and sober, people have a 66% chance of staying clean and sober forever. So that's a big difference. It's a marked improvement. But treatment doesn't always last 12 months. And so I thought, well, there was a way maybe that Living Free would be able to bridge that gap. When I got to Pahrump, I realized that's the case. You still need to do that. But I felt that in starting transitional living or sober living houses and adding the actual treatment to that component, sort of the whole entire wraparound service model in that regard, in addition with helping people with co-occurring disorders. In other words, people may have an addiction problem, but they may have PTSD, or they may have depression, or all of the above. So in taking that approach, what we wanted to do is to help people with addiction, co-occurring disorders, get them healthy, get them the life skills that they need, get them the time. The biggest thing is time clean and sober. The longer you're clean and sober, that's the greatest indicator of course, future success.
Well, how do you find your clients, or how do your clients find you? And if they had requests for information, who do they call?
Well, they could call our office at 775-505-1625. Our website also has a lot of information, and that is livingfreehealth.org. So those are two easy ways to get a hold of us. We're at the corner of Mesquite and Highway 160, so we're just 2 miles north of the Home Depot. Most people know where the Home Depot is. So we're very easy to find. The clients that we get come from a number of different sources. Some are self-referrals. Some are family has found us on the internet or heard about us through, I don't know, shows like yours, Tom, or different things that we've done in the community, and refer their loved ones or friends. We get some people from drug court. We get some people from parole and probation, and DCFS, Child Protective Services, Justice Court. So they're kind of a whole gamut of different people that we get that we are able to help.
If a person is, say, referred by let's say the drug court, and is there a requirement that they complete a certain program with you?
Well, the drug court has its program, and they need to follow there's certain milestones and behavioral components that they're required by the court, and oftentimes part of that, I think all the time, that is some level of treatment. But the court and parole and probation and other referral agencies like that with with regard to perhaps criminal justice. The treatment is up to us. We assess the client and assess what their need is and place them in the level of care which is appropriate for their condition at that time.
Oh, this is fantastic. It sounds like you're there and you can really provide the aid that the individual needs.
I think we can, and we do, and I think we do really an excellent job of that. One of the things that even before we had the treatment, we opened a men's sober living house. That was in March of 2018, and then in April of 2018, we opened the women's house. So they've been around for a while. Previously, we had charged for those houses. And when COVID struck us here in March, I mean, we had people in the houses and they all lost their jobs. And one of the things that I get concerned about, and I think all of our clinical staff and other staff were concerned about, is, I mean, financial stressors are a huge potential for relapse. So yes. I wanted to take that fear away from them. And we made the houses no charge whatsoever. And we're able to rely on donors in the community and outside of the community to provide us financial assistance in being able to pay the rent, being able to pay Valley Electric, those kinds of things, and that was very helpful at that time. Then in June we submitted for grants, so we were able to get a grant which just started October 1st. We have a grant that underwrites the transitional living for the existing men's house, the existing women's house. And then, which is an amazing thing, and the only one in the area that I know of, is a women and children's transitional living. So that women who have addiction problems or pregnant women, that's a house specifically for them that they can bring their children to. And now we have to limit that a little bit. So the children who are limited to age 10 and under, and each mother can only bring a maximum of 2 children. But having said that, we do have someone in the house at this time with a 10-month-old, and we're expecting more mothers with more children over the next couple of weeks. So wow. It's been we've really grown a lot in the last 2 years. We've reached out to a lot of people, and we're continuing to grow. And I think the important thing is we're continuing to meet the needs of the community in ways that haven't been met before. And you know, your previous guest, Marty, had talked about BACA, the Bikers Against Child Abuse, and some of the other ways that they're very involved in helping children. And I think that this house is really a line in the sand as far as being able to take very significant steps toward breaking that cycle or the intergenerational dependence that we see on a regular basis. We see a lot of mothers who have addiction problems, and you know, the kids go to CPS, or they're taken away, or there are all kinds of problems, and it's a very difficult thing, because what happens in addiction is that the addiction really becomes, it usurps control over the brain, and it becomes a top priority, even more so than your loved ones. It's a horrible thing. And so what we're trying to do is provide an environment where mothers can be back together with their children, that the children don't have to go through that sort of turmoil, and that they're in healthy, safe, structured, supervised environment from which they can be successful.
You know, I was going to ask, when you said there's no charge for the individuals, for the men's house or the women's house, I was going to ask how you're surviving, and even with contributions from the community. Yeah. And I assume the contributions still continue. Is that correct?
They do. When COVID hit, we got pretty well wiped out with almost everything. I'm sure. So that was very difficult. But we had been, you know, I feel like I'm a very wise steward of the money that we have, and so we were able to get through the roughest part. And when the market started to recover a little bit, a couple of months later into the COVID, we did start to get some donations back, not at the levels that they were before, yes. But again, we are very focused. Our board of directors is amazing, our staff is amazing, and our decision making is really around how do we help the community. So I always want to be in a position where when bad things do happen in the economy, which they will, they always do at some point, that you're prepared for the downturns. And I think we were as prepared as one could be.
And when COVID hit, what exactly did you have to do differently than you did before?
Well, we implemented all of the social distancing measures. We amped up all of the. We always clean. I mean, the bottom line is that we deal with people who have addiction. A lot of them come off the street. They're in bad situations. They clearly haven't been taking good care of themselves. So there's always a risk for tuberculosis, for HIV, for bronchitis, for pneumonia, for all kinds of things, just on a normal basis, a non-COVID kind of basis. So we are always very careful about cleaning and distancing, those kinds of things, but we really took it up another level as far as what we had to do when faced with COVID.
Well, it sounds like you get things under control, and you've also got the grant. So the grant is covering a lot of your needs, but well, is it covering all of your needs?
It isn't actually covering all of our needs. I submitted for another grant, which I hope will, but we're filling up, and the grant will not cover our needs for, having all 3 houses full or even close to full. But it's certainly a huge help, and but I'm very adamant about the fact that you can't just throw people in a house. You do need to have staff, and so. Yep. I'm working on trying to get more funding for additional staff and for the kinds of additional things that the clients may need, especially in the early, first or second month.
As we talk about living free and fitness, since it all goes hand in hand, these are the things that you have brought to our community, and it's being very successful. Now, I know we're going to run out of time in this session, but in the next session, we want to talk about how long it takes to go into recovery, how long it takes to complete it, what the rate is of people not having a recurrence. And I know you're able to give me all of that. So as we look forward to our next session, we're going to ask our viewers, stand by and look at everything that we've got going for you. And come and join us. Welcome back. We're so glad to have you back with us. I have as my guest Shelly Poerio, and she is the president of Living Free and Fitness, and she's given us so much information about exactly what's going on. But I want to clarify some information because we've talked about the houses she has for her clients. And she mentioned the fact that she had 3 houses. So Shelly, tell us, you've got the 3 houses. What are the differences in the 3 houses?
Oh, sure. We have the men's house, which you mentioned, the women's house, and I don't think I was as clear as I could have been. The 3rd house, which was officially opened on October the 19th, is only for women and children. So it can be for pregnant women and women with children. Okay. So at this point, and that it's restricted to that. So single women or, women not pregnant, no children, they would go to the other house. Okay. Yeah. So we're looking at that. And I do want to mention that just with all 3 houses, and in particular with this last one, because it's most fresh in my mind, the donations that we get of people's goods, and especially their time, it's just amazing. There's always a lot of cleaning. And in this last house, this 3rd house, there was a lot of baby-proofing kind of stuff that needed to happen, bolting bookcases into walls and these kinds of things. And we had a number of people in the community come out and volunteer hours and hours of their time to make sure that it's a very welcoming, happy home for our mothers and our clients.
Oh, that's great. I was going to ask what role the community has played in your success. Is that part of it?
Oh, absolutely. We basically, I brought the company here, we had nothing. So we've literally built something from nothing in Pahrump. And we can go back to September of 2018, where we got our office space, and it were just basically 2 empty suites. And there was a lot of cleaning that needed to be done. Then there was a lot of build out that needed to be done. And we had a number of people who volunteered to help with building. We had trades that helped us out, like Ken Murphy at Shadow Mountain Construction, Royce Avina at Avina Electric, P-Town Air. I don't want to forget anybody. We had so many people help us.
Great. Okay.
Yeah, on so many levels, with putting the houses together, but also putting the offices together as well.
This is fantastic to know that you have the community support and everything is going that way. But I want to read this question because I like the way it's worded. What are some of the biggest challenges our community faces regarding addiction and recovery?
Okay.
I know that's a lot, but I know you can go ahead and give us all of that information.
Yeah. Well, I think that one of the biggest challenges, and I don't think this is news to probably anyone in your audience, Tom, is that drugs are prevalent. They are everywhere. And we're not just talking about the legal psychoactive substances like cannabis or alcohol, but methamphetamine is the scourge. And I would say that 99%, it might be a high number, but maybe 95% of the people that we see have methamphetamine as part of their story. Opioid abuse is also part of their story, and frequently we see people with methamphetamine and heroin addiction simultaneously, and IV drug use. So how do you get over that? Because those drugs are extraordinarily addictive. All psychoactive substances have an addiction potential, but some more so than others. So how do you deal with that challenge when it's prevalent? I think that you can't, we can force people into treatment, but and anybody who's dealt with an addict or an alcoholic knows, until that person at least has some desire, that has some initiative for, or a desire for change, nothing's going to happen. It doesn't matter how hard you can lead a horse to water, right? But you can't make them drink.
Absolutely.
So when they're ready, we have to be ready. Yeah. So when that person is ready, there needs to be the resource for them available. Is there treatment available? Can they get an assessment quickly? Can they get a bed in sober living or transitional living quickly? And I think that Living Free Health has done an extraordinary job and continues to do an extraordinary job of scheduling so that we can get the people the help they need as quickly as they need it.
Okay.
Another piece of this is, and this is what I think we addressed a huge problem in the community as far as a challenge was concerned. We used to get a lot of women who would come to us and say, I need help. I need to get into sober living. I have children. And we'd say, I'm sorry, we can't take the children. Yeah. Well, now we can take the children. And that is huge because there often is not a safe place for that mother, for the children to go. And the home environment is toxic. It can be toxic in ways of domestic violence, toxic in ways of ongoing substance use in the house. And so to be able to pick up a mother and children out of that and put them in a safe environment where they can focus on family and health and getting better and the life skills needed to support that over the long run, that's what we aim to do.
Now, you did say you had a limit on the number of children.
Yeah, well, so it's a new house and a new program. And so what I've learned through my long history in business is that you might have a lot of plans for how things are going to work, but there are also a lot of unknowns. Yes. So what we're focused on now as kind of a ballpark is to have a maximum of 6 adult women in the house. And we estimate that maybe between 6 and 8 children, but it will really be dependent upon their needs, the needs of the children, and the needs of the mothers. Yeah.
Oh, that sounds good. We talked about addiction and recovery. In the recovery, how long do you expect them to be in the house? We generally look at assessing people and recommending between 6 and 12 months in the house. Whether they do that or not, or whether that ends up being appropriate for them, it's generally not longer than a year. Sometimes it's less than 6 months. I think that when you mentioned that too about recovery, so there's the treatment aspect of it, right? But then what are we doing also? What is Living Free Health doing for
long-term recovery.
Yeah.
And we are hosting 12-step meetings in our office. We have the support of Las Vegas's Foundation for Recovery. They send a person out under their grant because they're a nonprofit as well. And he supports us every other Tuesday in just another avenue toward long-term sobriety. Sober social support, activities that people can do, people that they can associate with who are healthy, who are not using, who are, for all intents and purposes, say doing the right things. That's what we want people to, it's a new way of living, right? It's a new way of life.
Sure. Mm-hmm. Now, you've been in the area for a while now, and when you look at your goals, your long-term goals, say we always talk about 5-year goals.
Mm-hmm.
What do you plan for the agency?
What I'd like to do in, I would say probably another 2 years, within 2 years, I'm hoping that we can get grants. I want to do this transitional living part correctly and well to begin with and make sure that that is smooth. But there is a huge need for an inpatient treatment here. Anytime anyone needs inpatient treatment or detox, they need to go to Las Vegas. And that is, it's difficult. I mean, if people oftentimes won't do it, right? Because they have to make a plan to get a ride to Vegas. So if we had that resource right here, people would feel, I think, it would be more welcoming. They would be closer to their families and to the people who are healthy in their lives to get that support. So a 5-year goal, which would actually be 2 years from now, so that would be 5 years that we've been here in Pahrump, would also be to have an inpatient treatment for people so that we could treat them inpatient and then lower their level of care by going to outpatient and maybe transitional living or just back to home.
Shelley, what would it take to get that here in Pahrump?
One of the difficulties that here, I mean, I feel like we could probably find a way to get the money. I'm always pretty good at making ends meet, to that degree. But one of the most difficult things I think is getting staff, is getting the clinicians, the professionals, because a lot of times we get people out of Vegas, they get tired of the drive after 6 or 8 months, and they leave. So toward that end, and I'm really glad you asked that because I didn't think about sharing this before, was that we are a practicum site for UNLV. So, and we're looking to be a practicum site also for Capella University. And what that would allow us to do is to have people who are working on getting their master's in social work or to be a licensed clinical counselor, those kinds of things, that they could do their practicums with us so that they would be able to develop their career here in town, and then hopefully we would have first dibs on a very high quality established clinician once they complete their program. So I think it helps people here in town with their career goals, and it would help us and the other agencies in town for that matter with having more qualified staff available in our hometown.
Now that's great. I heard you say UNLV. Now what about Great Basin College?
Oh, I'm sorry, I misspoke. University of Nevada, Reno, UNR.
UNR.
Yeah.
Okay. UNR.
But hopefully UNLV next.
How
So
about Great Basin College, since they have a group here?
Well, we would be very happy to work with them. What I was kind of referencing was these are master's level practicums.
Okay.
So it's a little bit different. But I do know we did have an intern from UNLV, or excuse me, from Great Basin, not too long, about a year ago.
Okay.
So, yeah.
No, this sounds like you've got a great program, and I know the viewing audience is very interested in what you're doing. So you've given your phone number, you've given your website, but why not do that again?
Okay.
Just for those people that are writing this down saying, I need to contact Shelley.
Sure. And please do. We have a great staff. You can call our office at 775-505-1625. I might add, we're open Monday through Friday, 8 a.m. We're usually there a little earlier, but 8 a.m. to 4 p.m. and Saturdays 9 to 2. So you can pop in if you want. livingfreehealth.org.
Okay. This has been a fantastic show.
Thank you.
And it's, again, I want to thank Shelley for being here. because she has brought so much information. When you talk about exactly what she does as far as living free of drugs, living free of addiction, and then the fitness that goes with that. But we're going to have another show for you next month, so come back and join us next month.